What have you learned in the past 2 weeks that you'd like to share with our audience here?
Sure. So the outbreak, obviously, we know is continuing to increase, unfortunately, and that's not surprising. So this is obviously a global incident. The case count is obviously way over 40,000, with over 1,000 deaths being reported, and we know that certainly that number probably is higher, generally speaking. But I think just on a global scale, this is very close to a pandemic type situation. It seems like the outbreak, is unlikely to be contained. Unfortunately, over 24 countries are obviously reporting cases. Luckily, there hasn't been a lot of community transmission and other cases outside of China, but certainly something that we are continuing to keep a very close eye on. And then just seeing, again, just the basic, public health measures that can be taken to help, address this particular outbreak.
I see, I see. So, interestingly, I think you mentioned in your in our last interview that at least for the United States, the seasonal flu is probably a more significant public health concern relative to the coronavirus outbreak. So, that was surprising to me, at least at that time. But can you just elaborate a bit more on that point? In terms of statistics, why should we in the United States be more worried about the seasonal flu?
Seasonal flu is something we see every single year, and it has a significant burden on the general American health, if you will, and even around the world. It has a significant burden on a global scale. But just talking more on a national scale, some of the statistics we have in terms of seasonal flu right now, and as you may know, in the Northern Hemisphere, we are still in peak flu season. So just within the past, obviously, few months that flu season has started, and it generally starts, somewhere in October, there's already been about 22 million Americans that have been infected with seasonal flu, and over 12,000 deaths being reported. And this is just as of obviously the last week, and this flu season hasn't even been declared over, if you will. Flu season generally peaks sometime in December and February, and it can actually still continue on until May. So we still have some time before this current flu season is actually declared over, if you will. So certainly a number of illnesses across the nation, a number of hospitalizations, actually over 210,000 hospitalizations have been reported this flu season. A number of pediatric deaths have been reported. So generally, when we see flu season, it is associated with a number of illnesses, a number of hospitalizations, and a number of deaths, which is very concerning. This particular flu season, it's still going strong. It is still peak flu season, so it's certainly not too late to get your flu vaccine, and that is the first and most important way to prevent getting seasonal flu. And even if you do get seasonal flu, so if you know just a little bit more about the epidemiology and the science behind viruses and just the vaccine for seasonal flu, you know that it may not be a 100% match. So you may still actually get seasonal flu depending on the strain that you get infected with and if it's not part of the vaccine. But the vaccination is still very important, because even if you do get seasonal flu, it helps lower your symptoms, or reduce your symptoms, if you will, in terms of severity, and it helps obviously decrease your chance of getting hospitalized. So certainly the first recommendation is, if you haven't gotten your flu shot already, please go ahead and still do so. It is still peak flu season time. We are still seeing a number of flu-related illnesses coming through healthcare systems as we speak.
I see, I see. So I have a small question about the flu shot, which you just mentioned. I always hear from public health professionals that you should be getting your flu shot. But, exactly when and where should we be getting it? Can you just sort of educate us a little bit on that front?
So flu vaccinations or flu shots are available through commercial and retail means. So if you go to your local pharmacy, for example, even near your local grocery store that has a pharmacy in it, they should be able to offer you a flu shot. So you can go and get it that way. Or you can go to your healthcare provider. So if you want to call, your primary care physician or whoever your healthcare provider is to get a flu shot. So there's a number of ways to actually get it. And it's actually fairly easy to actually locate areas where they offer flu vaccination. So CDC actually has a website where you can put in your zip code, and it'll tell you the surrounding stores and locations where you can actually get a flu shot.
Gotcha. So I know, public health professionals like you have been sort of diligently educating people about the importance of prevention, right? Flu shot being part of it. But, just for our audience who have not been paying sufficient, attention, can you just repeat some of the key points? What are the main items I should be checking off my checklist on a daily basis? I mean, I know, sort of getting flu shot is one big item, but also, washing my hands. But what other measures should I be taking to, best protect myself from getting the flu?
Absolutely. So there are a number of different ways that we can help prevent the spread of, respiratory diseases, or even trying to obviously ensure that we don't obviously get sick. And this is what we call everyday measures, everyday preventative measures. And so you named a couple already. So some of these include obviously first staying away from those that are sick. So if you know someone is sick, perhaps obviously not going near them or keeping at least a 6 feet distance from them. So for yourself, obviously make sure you're vaccinated if you're able to do so. If you obviously have a cough or sneeze, obviously respiratory, cough etiquette is very important. So coughing obviously in a tissue or in the crook of your elbow is obviously is a good way of obviously making sure that, whatever, if you are infected with seasonal flu, then the droplets that you're producing, obviously you're covering your cough, if you will. And then washing your hands. That's actually one of the best ways to prevent the spread of respiratory infections. And so washing your hands properly, at least 20 seconds, with warm water, with soap. And if you can't wash your hands, then obviously sanitizing your hands. And then there's additional measures you can take. So for example, continuously wiping down high-touch surfaces if someone is sick. So doorknobs, tables, things like that. And just, overall maintaining just good respiratory hygiene, if you will. So those are just some simple measures that we can take every single day. So whether it's seasonal flu time or just summertime, for example, when seasonal flu is not at its peak, these are preventative measures you should take every single day to make sure that anything else that is circulating, out there during that time period that may be respiratory in nature, this will help prevent the spread of such infections.
I see. So, we know, prevention is sort of one big part of the equation, but sometimes despite our best intention, we still get sick. But, just in the case that we get sick, I mean, even for us who have been living in the United States for quite a long time, the U.S. healthcare system is still a bit of a mystery to navigate, right? So, if I do get sick, what are the steps I should be taking? Should I, get the over-the-counter medicine? Should I go to my doctor directly? So, what should I do from that point on?
So that depends on a number of different variables. First, obviously, it depends if you're a healthy individual versus if you are immunocompromised, or if you're in the high-risk category, like a pediatric, population, or the geriatric population. So if you get sick, obviously, looking at, your acuity level. So depending on your signs and symptoms, and again, your immune status and what category you fall under, high risk versus low risk. If you think you need to see a healthcare provider, certainly please go ahead and do so. There are ways, obviously, to help alleviate some of the signs and symptoms that you may be experiencing through antiviral medications. And obviously, those are prescriptional medications, and you would have to see a healthcare provider to get those types of pharmaceutical interventions, if you will. But obviously, there are over-the-counter medications. But again, it's always best to see your healthcare provider if you think that, you are feeling ill enough to, that you want to seek help.
I see. So finally, so there is sort of a personal hygiene point that was brought up by Professor Michael Levitt of Stanford University, a Nobel Prize winner, during an interview I did with him a while ago, which I thought was a really interesting point. So he had this one small suggestion to public health professionals. The idea is that the public health debate has been sort of focusing too much on whether I should be wearing a mask, the correct way to wear a mask, and how often should we be washing our hands. But it seems like we haven't been paying enough attention to another source of contamination, which is our smartphone. And nowadays people use their smartphones all the time, and I literally cannot leave my phone for like 2 seconds. So what's your suggestion on that front? Like, how should we keep our phone clean? And it's not as easy as washing your hands. I just can't like wash my phone, right? So every time I wash my hands. But how should I keep my phone clean? How often I should be cleaning my phone?
So that really falls under the category of high-touch surfaces, if you will. So phone is something that we do obviously touch very, very often. And it's similar to how you would clean a doorknob or a table or other, obviously, surfaces where you think, you use it very often and you want to obviously clean off the contaminants. If you want to use a Clorox wipe or a disinfectant. It's a good way to obviously continue to wipe down those types of surfaces that you're going to constantly be touching, and then perhaps even touching your mucous membrane. So a lot of times we're touching our phones, we're bringing it obviously up to our face, and then we're touching our mucous membranes on the face inadvertently. So it's always good to obviously clean those types of high touch areas.
I see. So yeah, so this has been super helpful. I know you are super busy, so I will let you know. But this has been super helpful. I hope we can, continue this conversation on a regular basis. But thank you so much. Bye, Dr. Sarah Madad. Bye.
Thank you. Bye.
好，各位观众朋友们，大家好。刚才呢，您听到的是来自 Dr. Sarah Madad 的声音，他呢是纽约地区的有关于流行病防御的最高官员。那么，对于不熟悉英文的观众朋友们在整个这个节目结束之后呢，我会给刚才那段访谈配上字幕，方便您看。但是现在呢，也简单为大家介绍一下刚才 Dr. Sarah Madad 跟我说了一些什么内容。我首先呢向他问到就是我们上次采访呢已经是在2个星期之前了。那么最近2周呢，在武汉的这个疫情状况有了新的发展。然后呢，我就首先向他咨询，就是有关于武汉疫情的最新发展，他有没有什么新的想法？然后呢，他呢就首先就跟我说了一组数据那这组数据呢，我们其实已经知道了，就是现在呢已经死亡人数超过1000人，受感人数即使是官方这边的数字呢，也已经是超过4万人。所以他认为现在很明显，就是整个武汉的疫情呢已经是 pandemic 就是在超过一个地方这种大流行的状况那么如果您熟悉 Netflix 的这个网飞的这个纪录片的话呢，你会记得他在其中饰演重要角色这部纪录片呢就叫做 Pandemic。 而在他的观点看来呢，现在武汉的疫情已经构成了一场 pandemic。 那么当时呢，他也表示说会继续观察武汉疫情的发展，并且呢提高相应的警惕。随后呢，我就问到说，在我们上次采访的时候呢，他就向我提到说，至少呢是在美国，其实呢更加值得公共卫生系统去关注的，不仅仅呢是武汉的这个 coronavirus， 也就是冠状病毒的发展其实还有就是在美国本身的季节性流感我们叫做 seasonal flu。 那么当时呢，他也向我表示，就是说其实在美国的这个 seasonal flu 是比武汉的 coronavirus 在美国而言是更值得关注的公共健康问题。然后呢，我也向他询问，就是为什么要这样讲。他呢同时就给我提供了一个统计数据那么就是呢，整个流感季呢大概是从去年10月份开始的，然后呢在12月份到2月份呢应该是叫做 peak season， 也就是说高发期或者叫高峰期。而这次呢，整个到目前为止其实还没有到高峰期的结束，整个美国呢就已经有超过了2200万人感染就是非常可怕的数字。而现在呢还没有明显退去的迹象，所以呢他也向我特别强调，就是如果你还是没有去打疫苗，就是没有去就是我们叫做 flu shot， 没有去做这个疫苗的话呢，一定要尽快去做了，因为的确是非常重要的情况。那么呢，如果您不在美国的话呢，也需要向你当地的这样一个公共卫生医疗官员去了解，到底这样的一个季节性流感在您当地这个 flu shot， 也就是这个疫苗到底是一个怎么样的打法，这当然是非常关键的。然后呢，我又向他询问就是说我们经常听到要去打疫苗，那么到底应该怎么打疫苗呢？那么他呢也给我提供了很多方式就是现在在美国呢有一种是就是叫 commercial 的疫苗，就是说比如说你去 CVS， 那么呢就会有这样一个疫苗防疫站，你就可以在那个地方去打疫苗。而同时呢，如果你有一个固定的医生的话，你还没有打疫苗的话呢，那一定要尽快的去联络到你的医生，这样的话呢，他就可以告诉你，要么是在他的 office 里面，要么呢是安排你去进行打疫苗。所以呢，这个呢是非常关键的一个防疫步骤。同时呢，它有一个小贴士提供给大家，就是说，如果你真的不知道到什么地方去打疫苗的话呢，可以到 CDC， 就是美国的疾控中心他们的官方网站去只要你输入自己的邮政编码，那么呢，这个网站就会显示给你到什么地方，就临近的地方去打疫苗。那么这呢，就当然是非常方便的一个举动了。之后呢，我又向他询问除了打疫苗之外，我们还有哪一些应该做好的防御措施？可不可以让他帮我们这个重复一下那么他呢，首先就是说其实呢，每天的这个防疫措施是最关键的。那么不仅仅的是每天要按时洗手，然后呢要打疫苗这样的措施之外呢，同时呢也好注意好保护自己。那么就是说，比如说如果你知道你发现对方在咳嗽，那么对方呢似乎是有一些感冒的症状的话呢，那么一定要注意和他们保持距离。而同时呢保护自己的同时也注意保护别人。比如说我们在咳嗽的时候呢，就一定要遵守他说的就是叫做 cough etiquette， 就是说礼貌的咳嗽。什么叫做礼貌的咳嗽呢？也就是说不要直接对着别人去咳嗽或者打喷嚏。如果你真的需要咳嗽的话呢，应该拿一张餐巾纸然后就是保证了这样你咳嗽的时候可以咳到餐巾纸里面。或者呢，我们叫做 elbow cough， 也就是说这个把你的肩膀 抬起来，然后咳嗽的时候呢，冲着你的嘎吱窝，就是腋窝这个地方来咳嗽，这呢也是比较安全的措施。同时他还特别提到一点，就是呢很多我们平常经常接触的表面，比如说你的工作台，然后你的桌子等一等，都需要定期的进行消毒工作不管是用专门的消毒液也好，还是用那种现在比较方便的那种 wipes， 就是那种有消毒成分的这样的纸巾也好去做这样的工作，其实都会对自己起到有力的保护。然后之后呢，我又向他说就是说一般来讲我们的防御措施只是一部分，同时呢，有的时候我们即使做好了防御措施，也会有生病的迹象。而在美国呢，这个医疗系统又非常的复杂，所以呢，我们到底应该怎样做？如果发现自己有症状的话呢？那么他呢就告诉我说这个呢很大程度上是取决于我们自己本身的健康状况的。那比如说呢，如果只是轻微的状况的话呢，那么有这样的一些 over the counter 就不需要这个医生的这个签字书的这样一些药品就可供你购买，可以帮助你呢减轻症状。但是呢，如果你的确是生病的话呢，那么最好的方法还是第一时间要跟你的医生联络，让他们呢为你的治疗提供下一步的方案。在最后呢，我又向他问到那么这一点呢，是我之前在采访斯坦福大学的教授 Michael Levitt， 他呢是一位诺贝尔奖的获得者中对方所提到的一点，就是说呢，现在我们整个这个公共卫生体系似乎非常强调的事情就是洗手，要按时洗手，然后要呢用温水，然后用 soap 来洗手，然后另外一点呢就是要戴口罩。戴口罩呢有很多争议到底应不应该戴，什么样的口罩才值得戴的？但是呢，有一点似乎却被忽略了，就是我们的智能手机。现在呢，好像每个人呢都离不开自己的手机，而手机呢又是和人脸，然后甚至和人的一个呼吸系统这些器官呢时常有接触的。那么怎么样清洁手机才是最推荐的方案？那么呢Mada 博士呢也向我推荐了有关的方案。其实呢就是就是我们刚才提到的，在你在清理表面，比如说你的桌子呀、你的台面的同时呢，手机也是其中的一个，因为手机也是你经常接触的这样一个光滑表面，所以呢，不管是用消毒液也好，还是用那种有消毒成分的纸巾也好，都要定期的来擦拭你的手机。他特别提到，因为呢手机和这些台面还不同，它可以直接的碰到你的脸部，甚至呢是你的呼吸器官，所以呢经常是一个污染的来源。那么呢，以上这些信息希望对您有效不管您是身在中国还是身在其他地方，保护好自己，特别是在这样的一个流感季都是非常重要的。那么这一段专访的内容呢，如果您感兴趣的话呢，我们也会配上字幕，然后呢把它放到我们华尔街电视的一个相关的这样一个专门的节目里面，供您之后参考。好，那么今天呢，这个就是我们华尔街论坛的第一部分内容下面呢，我们马上要